Colistin, uses, dosage, side effects, and drug interactions. Colistin, also known as Polymyxin E, is an antibiotic that has been used for over 50 years to treat serious bacterial infections, particularly those caused by gram-negative bacteria that are resistant to other antibiotics. It is known for its rapid bactericidal activity and is often considered a last resort treatment for multi-drug resistant infections. Colistin is available in various forms, including injections, colistimethate sodium, and topical applications, colistin sulfate. However, oral tablets are less common and are typically used for specific purposes, such as bowel sterilization before surgery. What is colistin? Colistin is a cyclic polypeptide antibiotic produced by Bacillus colistinus. It comes in two main forms, colistimethate sodium, which is used for injection or inhalation, and colistin sulfate, which is used topically or orally. Colistimethate sodium is a prodrug that is less toxic than colistin when administered parenterally. Colistin is particularly effective against gram-negative bacteria, such as Pseudomonas aeruginosa, Klebsiella pneumoniae, and Acinetobacter, which are often resistant to other antibiotics. Benefits and uses of colistin. Colistin is primarily used to treat severe infections caused by multi-drug-resistant gram-negative bacteria. It is effective against hospital-acquired pneumonia, urinary tract infections, UTIs, bloodstream infections, meningitis, and wound infections. It is also used for bowel sterilization before surgery and in critically ill patients when other antibiotics fail. Conditions colistin treats: hospital-acquired pneumonia, urinary tract infections, UTIs, bloodstream infections, meningitis, wound infections. Secondary uses: prevention of bowel sterilization before surgery, treatment of infections in critically ill patients. Colistin is often prescribed when other antibiotics are ineffective, making it a crucial option for treating infections caused by resistant bacteria. How does colistin work? Colistin works by binding to the lipopolysaccharide, LPS, in the outer membrane of gram-negative bacteria, disrupting the membrane and causing the leakage of bacterial contents, which leads to cell death. This mechanism makes it particularly effective against gram-negative bacteria. It does not affect gram-positive bacteria or fungi. Colistin dosage. The dosage of colistin depends on the severity of the infection and the patient's condition. For adults, the typical dosage is 2.5 to 5 mg/kg/day, administered intravenously or intramuscularly, divided every 6 to 12 hours, with a maximum of 5 mg/kg/day. For children under 12, the safety and efficacy of some forms are not established. What should I do if I miss a dose of colistin? If you miss a dose, take it as soon as you remember. If it is almost time for the next dose, skip the missed dose and continue with your regular schedule. Do not double the dose to catch up. What happens if I overdose? Symptoms of overdose may include stomach ache, nausea, vomiting, and in severe cases, respiratory arrest. If you suspect an overdose, seek medical attention immediately. Colistin dose. Susceptible infections, 2.5 mg/kg/day divided every 6 to 12 hours intravenously/intramuscularly. Renal impairment, 2.5 to 3.8 mg/kg/day 4/IM divided every 12 hours. Side effects of colistin. Colistin can cause several side effects, ranging from common to serious. It is important to monitor for these effects and consult a doctor if they persist or worsen. Common side effects: kidney damage, diarrhea, nausea, vomiting. Serious side effects: burning or tingling sensation, stomach discomfort and cramps, weakness in arms, hands, legs, and feet, severe difficulty breathing, blood in urine, skin irritation. If any side effects persist or worsen, contact your doctor immediately. Precautions and warnings. Before using colistin, inform your doctor if you are allergic to it or to related medications like Polymyxin B. It should be used with caution in patients with kidney disease, liver disease, or nerve/muscle disorders. Colistin may interact with other medications, so it is important to inform your doctor about all the medicines you are taking. Who should avoid this medicine? Patients with known hypersensitivity to colistin or polymyxin B. Patients with severe kidney impairment, unless absolutely necessary and under close monitoring. Conditions where caution is needed. Kidney disease. Liver disease. Nerve/muscle disorders, e.g., myasthenia gravis. Are there any age restrictions for using colistin? For children under 12, the safety and efficacy of some forms are not established. Alcohol or food interactions. Limit alcoholic beverages as they may increase dizziness. No specific food interactions are noted, but follow your doctor's advice on diet. Colistin contraindications. Known hypersensitivity to colistin or polymyxin B. Severe kidney impairment, unless necessary and monitored. Possible interactions with other medications. Colistin may interact with other drugs, particularly those that affect the kidneys or the nervous system. Always inform your doctor about all medications, supplements, and herbal products you are taking. Drugs to avoid or use with caution. Other nephrotoxic drugs, e.g., aminoglycosides. Neuromuscular blocking agents, e.g., pancuronium, cisatracurium. Live bacterial vaccines, e.g., typhoid vaccine. How should colistin be stored? Colistin should be stored at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius and 25 degrees Celsius, away from heat, air, and light. Keep it out of reach of children and in a safe place to prevent accidental exposure. What happens if colistin is not stored properly? Improper storage may lead to degradation of the medication, reducing its effectiveness or potentially causing harm if used.